For example, in Western and more developed countries where long-term care and assistive provisions are more easily available for older persons, concerns with regard to institutional abuse are predominant. And in some traditional societies in Asia and Africa, widows have more risks to abuse and maltreatment, and incidents of having their property seized and being abandoned by their families are common. Um, the concept in some of the Asian countries, including India, where older people traditionally are revered, ironically, abuse of older people is on the rise. The concept of filial piety is strong in many countries, yet uh, it is indicating that Asia has high prevalence of elder abuse. And some studies are pointing out that in China, there's 36%. And in India, there were some studies which said comparatively it's low, 14%. But recent studies have come out that it is quite high, up to 60%. And it is being commonly is found among community dwelling older adults. It is interesting that while many older people don't report abuse experienced by them, but they feel that it is prevalent in the society. So studies based on perceptions of older people across countries indicate the prevalence to be over 60%. In addition, it is pertinent to understand that the form of elder abuse seen during COVID-19 pandemic has a universal characteristic. We see everywhere ageism, discriminatory isolation, loneliness, neglect, abuse prevailing. The responses to addressing the challenges have varied around uh, the universe, and some countries are better prepared to tackle abuse of older people for various reasons, mainly because the governments recognize the problem, have adequate legislations in place, and have focus on preventive strategies. Besides, there is a stronger emphasis on recognizing the rights of older people and generating a public health response, incorporating various dimensions from a societal perspective. Today, experts from various disciplinary backgrounds are researching on the issue, developing interventions both from a preventive and a combating approach. With regard to India, very briefly, I want to state that we now have few surveys done at the national level which indicate the gravity of the situation. Even though reporting of abuse is low, as it is in many other Asian countries. In India, as also in Singapore, Thailand, Indonesia, Hong Kong, there have developed caregiver interventions, money management programs, helplines, emergency shelters, and multidisciplinary teams to combat elder abuse. In these countries, we now have legislations and policies in place. India has a newly amended the Maintenance and Welfare of Parents and Senior Citizens Act. This legislation has penalties for victimizing older people. The Act states provisions for medical care of senior citizens at the community level and also in institutions. Strengthening geriatric services is an essential aspect of the Act. There are also enforcement provisions, supportive measures for life and dignity of older persons, and with the involvement of the health sector, detection and management of abuse is taking place. The policy for senior citizens, whose draft is ready, brings focus on addressing elder abuse. Now, elder abuse is quite a serious problem in Asia. And while there is some commonality among these countries regarding the perception of elder abuse, and studies are indicating that most feel disrespect, beating, slapping, verbal abuse, economic exploitation, unwelcome or forceful sexual contact and neglect are some of the major experiences. And often there is interplay between disrespect, verbal abuse, and neglect. The incidence of abuse within its various forms of occurrence, physical, financial, psychological, emotional, neglect, abandonment, is seen to have many-fold impacts on the health and well-being of the older person. Yet, while services are developing, but at present, programs are limited to address the concern in Asia. Shelter homes for older people are few, and wherever they exist, much needs to be done about maintaining quality standards and adequate provisions for the upkeep of the older people who are victims of abuse. It's a good gesture that many religious organizations have stepped in to provide care of abundant older people. We see many philanthropic organizations and NGO sectors providing and managing old age homes and short-term shelter provisions to give relief to abused older people. There are examples from India, Nepal, from Philippines, from Indonesia, to name just a few countries. In addition, studies are indicating that crime against older people is increasing, and we see more of thefts, murders, assaults taking place against older people. But reliable national data is still not available in many countries. Some data through National Crime Record Bureau gives us an indication of the rise in crime against them. But this is only based on reported cases. And we know that many senior citizens, older people, are hesitant to come forward for their complaints with fear of repercussions. And also, many of them do not have faith and belief in the justice system. So they have difficulty in providing evidence of crime, as well as hesitate to be vocal against such issues. So we need to really come up with some kind of national and international cooperation on how to raise awareness about reporting and sort of safeguarding the interests of older people. In many of the Asian countries, we find that the property matters are leading to a lot of abuse of older people. And although the government policies are supporting older people in many respects, but we find that uh, much more needs to be done also to bring awareness among the caregivers, the family members. And some countries have started giving certain kinds of incentives which can support families to take care of older people. Like Singapore has some good examples, China has some good examples, and uh, but many other countries need to take up this issue in a more concrete and constructive and positive manner. What we do find is that studies are showing that complaints about abuse have increased from the age group of 60 to 69, mainly because this segment of the population is seen to be more literate. So literacy does have an impact on bringing awareness, taking action against abuse. And but the most vulnerable are those above 80 years who are less likely to raise their voice against abuse because of various vulnerabilities related to health, economic dependency, and their own systematic weaknesses. So, in general, amongst the older people, older women are more reluctant to seek help, but studies are indicating that they have more vulnerability to abuse, especially as care providers. There is more burden on them increasing, more neglect of them as care receivers is happening, and uh, uh, many societies have not, communities and governments have not been able to provide community approaches to handle abuse, where older women can be beneficiaries. So, in some of the, especially South Asian countries, we find that proper channels to stop abuse and help the victims are not there. But the health system is now trying to build up a kind of, through a primary care approach, to reach out, to detect, and to manage elder abuse from this perspective. So, in many of these countries, legislative measures which have been recently adopted are dealing with the issue of abuse, but still the redressal measures haven't developed to the extent that they can provide robust and solid solutions to addressing elder abuse. Generating the societal response to elder abuse, although has emerged, and we see many NGOs getting very active and visible in not only raising awareness, but providing helplines, sensitizing children, and strengthening intergenerational bonding. And this kind of thing is seen in many countries, in Asia in particular. And we find the social media also becoming very strong and active in reaching out, not only to raise awareness, but provide solutions to addressing elder abuse. And there is a strong sentiment for having better social security provisions for older people in the different countries, so that there is greater economic independence for older people, and their vulnerability to abuse gets minimized. And we have now certain provisions in a few of the countries, especially in Asia, where there is a more emphasis being brought about to bring in universal pension coverage. Giving examples from India, Nepal, Bangladesh, Sri Lanka, we find that the Parents Maintenance Act is proving to be quite a strong and very assertive uh, redressal measure to support older parents and senior citizens who have been deprived of economic benefits and care from their family. So the act is trying to ensure social security for older people in all these countries, and bringing in children to provide extra care to people who need it. So these are some of the steps which have been taken in these countries. And significantly, we find that, as even Susan was trying to point out, and I have been involved with various UN agencies, we are now reviewing the Madrid International Plan of Action after its 20 years of implementation. And there is special emphasis being laid on how we address elder abuse. So today, this webinar, which will have few countries giving us examples of addressing elder abuse, is a very important webinar. And I hope that you will continue to have a dialogue on this issue. And together we can try and bring about some kind of action plan which will help us take it forward. So, as part of my NGO, Development Welfare and Research Foundation, as well as I'm the representative, Asia representative for International Network for Prevention of Elder Abuse, and ACAP. I'm going to be discussing with Catherine and members of ACAP how we take forward in the coming years implementation of things so that we can combat elder abuse significantly And like I said, that I would like those who want share some of the books which have been written by me, which bring about different country responses to this issue in terms of global perspectives, in terms of human rights approach, and in terms of empowering older people to think about how to not be victims of elder abuse. So with that, I stop, and hopefully we will continue with our dialogue, and other speakers are going to share very specific examples from their countries in addressing elder abuse. Thank you so much.
Thank you. Thank you very much, Mala. Wonderful. Thank you for that welcome, and thanks for representing Susan as well. Yes, of course, this is a big concern for us, and we are here today honoring the World Elder Abuse Neglect Day with this webinar. So many people, Mala, are interested in your book. And so please, if you can put the link to your book in the chat, then people can link to it directly and find it.
Sure.
Okay, super. So our next speaker is from Japan. We have Dr. Tadashi Wada. He's a primary care physician and a certified specialist in home care medicine. He also serves as clinical professor of Tokyo Medical and Dental University and Chiba University. He chairs the Protective Services Agencies for Older Persons and Disabled Persons in Matsuro City Government and is serving as a counselor of the Japan Academy for the Prevention of Elder Abuse. So we're so happy to have a representative from Japan presenting to us, Dr. Wada. Thank you. The floor is yours.
Thank you. Thank you, Catherine. I'm Tadashi Wada from Japan. It is my great pleasure and honor to speak here in this session with professionals all over the world. I'd like to talk about our efforts to improve legislation against elder abuse in Japan. Next slide, please. I have nothing to disclose. Next slide. There is an act for elder abuse prevention in Japan. That is the Act of Prevention of Elder Abuse, Support for Caregivers of the Elderly Persons, and other related matters. The Elder Abuse Prevention Act, in short, enforced in 2006 and is carried out closely connected with the social systems based on Long-Term Care Insurance Act. Both the Elder Abuse Prevention Act and Long-Term Care Insurance Act are executed by municipal government. Next slide, please. This is main features of Elder Abuse Prevention Act, enforced in 2006. Definition of elder person, 65 years of age or older. Definition of elder abuse, physical abuse, neglect, psychological abuse, sexual abuse, and financial abuse. Elder abuse is defined according to perpetrators such as caregivers in domestic settings, care facility staff members, and in-home elderly support service providers. Next slide, please. Our home ground is Matsudo City in Chiba Prefecture, Japan. This city is neighboring to metropolitan Tokyo. The city has population 500,000, older population 65 years or older, 26%. Next slide, please. Next slide. Next one. Next slide, please. Can you hear me? Oh, thank you. You can see beautiful Mount Fuji from Matsudo City. I'd like to talk about case study conducted with reported cases with our city. Next slide, please. Next one. Okay, next one, please. The Elder Abuse Prevention Act excludes abuse by non-caregivers. According to the Act, elder abuse is defined as those inflicted by caregivers. Therefore, there is a big problem that abuses by non-caregivers are excluded from the coverage of the Act. We are investigating abuses by non-caregivers to clarify the proportion of excluded cases among those reported to the elder protective services. Next slide, please. In assessing the defects of definition of Elder Abuse Prevention Act, we employed WHO definition of elder abuse to compare with it. WHO definition is comprehensive one, including abuses by both caregivers and non-caregivers. Next slide, please. This is WHO definition of elder abuse. I'm sorry, I don't talk much about it because I think all of you know about this one. Next one, please. During annual 2017 to 2019, Matsudo City Elder Protective Agency, Elder Protective Service Agency received 525 case reports of domestic elder abuse. We studied the effective records of 497 of these cases. Only 299 were confirmed as elder abuse cases according to the Act, but 198 cases were excluded, not meeting the requirements of the Act. 176 out of 198 excluded cases were WHO abuse cases. In all, 176 abuse case was carried out by non-caregivers. According to the Act, these excluded cases went undetected and victims were unprotected. Next one, please. This is an analysis of reported cases during 3 years. 35.4% of WHO elder abuse cases were excluded from elder abuse in Japan. We consider the definition of elder abuse of the Act should be corrected in order to give appropriate protection for abuse by non-caregivers. Next one, please. This slide is looking at abuse by caregivers and abuse by persons living together. Elder abuse in Japan could detect only 63% of WHO elder abuse cases. On the other hand, abuse by caregivers or abuse by persons living together constituted 96% of WHO elder abuse cases. If abuse by persons living together is added to the definition of elder abuse of the Act, most of the actual abuse cases will be detected. Next one, please. Next slide, please. Next, I would like to talk about amendments of Act proposed by Japan Academy for Prevention of Elder Abuse. They are under discussion. Next slide, please. Among proposed amendment by the Academy, I would like to select and talk about only 4 issues. First, self-neglect should be added to the definition of elder abuse. Self-neglect is defined as one of the elder abuse in most states of the United States of America. Therefore, it should also be included in the concept of elder abuse in Japan, we think. Next slide, please. Second, concept of elder abuse by persons living together with victims and other perpetrators in addition to caregivers should be included in the definition of abuse in the Act. The Act in Japan covers only 63% of WHO abuse cases. The concept of elder abuse should be widened to protect more actual abuse cases, we think. Next one, please. Third, physical restraint should be included in physical abuse. physical restraints is clearly stipulated in the Act for Protection for Disabled People. That is the Act on the Prevention of Abuse of Persons with Disabilities and Support for Caregivers. Therefore, it should also be clearly stipulated in Elder Abuse Prevention Act. Next one, please. Fourth, abuse by medical care staff members should be stipulated in the Act. In the Act, elder abuse committed by caregivers in domestic settings and that by care facility staff members and home care service providers are delineated, but not abuse by medical care staff members. We think that should be included. Next one, please. We are tirelessly trying to improve the legislation to confront elder abuse effectively in Japan. We have learned a lot from experience and systems solving elder abuse issues in other countries all over the world. Next slide, please. Press the key, please. Press key, please. One more press, please. Thank you for your attention.
Thank you very much. And that's so interesting about the definitions and how important it is that we try to standardize the definitions across countries and around the world and then really try to follow those. Those were amazing statistics, Dr. Wada. Thank you for sharing that.
Thank you.
Okay, so now we are going to move to Canada, and we're going to hear from Joan Braun, who is an assistant professor at Bora Laskin Faculty of Law at Lakehead University in Thunder Bay, Ontario. And prior to her current position, she worked in the elder abuse response field, where she oversaw a variety of educational, social, and legal programs for older adults. In 2008, she established Western Canada's first specialty legal aid clinic for older adults, and she previously served as chair of the Canadian Network for the Prevention of Elder Abuse. She will speak to us on elder abuse in Canada. Welcome, Joan.
Thank you. And thank you for the nice introduction and for giving me the opportunity to be here today. So before I prepared this presentation, I thought that it would be interesting to contact some of the major elder abuse response organizations in Canada and ask them what they thought were interesting projects going on, et cetera. So I did that, and so part of this is based on that. My outline is going to follow the following format, essentially. Talk a little bit about generally trends and kind of in the aging and elder abuse field in Canada. And then I want to talk about what the government is doing, because there's been some recent developments that I think are quite interesting. And then this is where I'm drawing from what my colleagues, some of their ideas about which were leading and innovative projects here in Canada. So I'll give some examples of some initiatives and projects by nonprofit, by NGO agencies to respond to elder abuse. So my argument, if I was to make one, would be that overall in Canada, there's an increased attention to elder abuse due to a number of factors. I've identified 3 here, and I'm going to talk about them briefly. But as I go through these slides, there's also been some recent studies that have revealed really that the problem of elder abuse is growing, which is, I suppose, not surprising since the older population is growing as well. I see that my last bullet point here says understanding that the current response is inaccurate. I think I meant inadequate. I reviewed the slides and missed that little typo there. But let me talk about each of these things in turn. So I'm saying that overall, there's an increased interest in elder abuse and increased things that the government is doing to respond. And these are three of the reasons why, I think. So first of all, the same as is happening in, around the world, is that there's, of course, the demographic shift where the older population is increasing. Now, I should say, just as an aside, because this may perhaps be interesting, we've talked a little bit about definitions, the speakers so far. And Canada, of course, I'm going to talk a little bit about the inadequacy of our definitions of elder abuse, but we actually don't even have a uniform agreement over the definition of older adults here in Canada. So there may be in other countries, but not so much here. So there's a demographic shift. And just to give one little statistic, as of July 2020, there was more than 38 million people living in Canada, which includes under 7 million persons over the age of 65, which is 18% of the population. The Canadian population of older adults is expected to grow by 57.2% from 2020 to 2040. So, where there's that kind of shift going on, there's a need to figure out how to respond. And one of the issues that's prevalent or that impacts on older adults, of course, is abuse. And so here in Canada, there's only been essentially two national prevalence studies to look at how prevalent elder abuse was. There was a pretty exciting one in 2015, partly because before that study was commenced, they actually spent some time reaching consensus about definitions before testing prevalence. And that particular study found that the aggregate prevalence for elder abuse in Canada during the previous year was 7.5%. And the prevalence of neglect being 1.2%. So, it's a problem. So I think that, as people have become aware that the older adult population is growing and that, that abuse is really a problem, more attention has been paid to it. But one thing that's brought more attention to the issue here in Canada is problems that really reared their head or became evident during COVID. Now, those problems were already there, of course, but COVID kind of revealed them. And one of those problems was that our long-term care home system here was completely inadequate to deal with COVID in long-term care homes. In fact, in the province of Ontario, there was many deaths that occurred in long-term care. And at one point, the military was sent in because there was such staffing shortages. And the military wrote a pretty scathing report about neglect that they were seeing in long-term care institutions. One of the things I'll talk about in an initiative a little bit later in my slides is there's some work now on new long-term care home standards, which started around the time of COVID. So I think there's a connection there. And then lastly, there's, I think, an understanding and a recognition that the current response to elder abuse is inadequate. I'm going to mention a study in a few minutes, a federal government study, and where there was consultation with many experts in the field. And I think it was a consensus among all that the current government response is inadequate and new things need to be done. So, through lobbying and awareness raising by those working in the field, there's a growing recognition that more needs to be done. So, and as I said, this has been recently acknowledged in recent studies with specific recommendations being made. So now let's talk about what some of the examples of government responses. I'm going to talk about, give examples from 3 federal government initiatives and 1 provincial initiative. And I should just mention that here in Canada, certain areas of legislation belong to the federal government and certain ones belong to the provincial government. So for example, here in Canada, criminal laws is an area that the federal government it passes legislation and is in charge of. Health is provincial government. So, there can be differences from province to province. So the federal government There actually is no universally agreed upon definition of elder abuse in Canada. The study that I mentioned, which is got the title Into the Light, the prevalence study, where they did some work on definitions at the outset, did create some definitions, but those haven't necessarily been adopted outside that study. So the federal government in 2019 gave the Minister of Justice and the Minister of Seniors a joint mandate to create a national definition of elder abuse. And the work on that particular project has continued even into this year. So last year, the federal government started work on examining elder abuse definitions, and this involved consultations with many of the leading organizations and experts in the elder abuse response field. So definition of elder abuse, long-term care home standards. So this past year, some new national standards have been released to improve Canada's long-term care facilities. As I already mentioned, residents and staff have borne the brunt of the COVID-19 pandemic. So a draft of these recommendations was unveiled for public review just really recently. And this was part of a 21-month-long process involving lots of consultation with stakeholders. However, there is some debate about how effective the standards will be. On the one hand, the standards make a lot of improvements about what's required in long-term care homes, but healthcare is under provincial jurisdiction. So the federal government can encourage provinces to adopt the standards, but the standards are federal, so they can't force provinces to adopt those. And then lastly, I particularly like this last one, and maybe that's because my background is in law, so I'm always interested in studies that touch on law, but our federal government actually recently formed a parliamentary study to examine elder abuse, looking specifically at the insufficiency of current laws. We're very different here in Canada than, say, our neighbors to the south. The United States has specific criminal code offenses related to elder abuse. Here in Canada, that's not our approach. So if, say, there's an assault against an older adult, the person who does that could be charged with assault, but we don't have any specific crimes related to elder abuse. So that was one of the issues that was looked at in that study. Is that a good thing or a bad thing? And, should we adopt the American approach or continue as we are? But the report actually, so they had a consultation with many stakeholders and major groups. And at the end, the parliamentary committee came up with recommendations. So 4 examples of these recommendations are that steps should be taken to create a better definition of elder abuse. There should be strategies to do better data collection. More resources are needed, and it's time to look at criminal code legislation. So that's that study. This example from the provincial government in British Columbia, actually, we have a seniors advocate in some provinces, and this is a person appointed by the provincial government to look into issues affecting seniors. So the provincial advocate actually did considerable investigation into elder abuse and response in British Columbia, again, with lots of consultations. So a report recently came out looking at legislation. And one of the things that the review highlights is that reports of abuse and neglect of people aged 65 and over have increased significantly in the past 5 years. And stakeholders who participated in this, and this was documented in the report, said that there was a lack of public awareness, a fragmented reporting and response system, gaps in services, and need for training for those working with seniors in the community. So, and that report had 5 recommendations, but I won't read what those are. Now I want to give you some examples just quickly of some projects. And these were the projects that my colleagues flagged as being interesting ones worth sharing with you. So so these are our projects, typically nonprofit organizations, and I imagine it's the same in most, many countries. is that nonprofit organizations will seek funding from government or from foundations to run initiatives or projects. And so this is primarily the work of nonprofit organizations. Even in the provinces, often there'll be federal government funding for organizations in provinces, but money could come from foundations or other places as well. So the CNPEA is the Canadian Network for the Prevention of Elder Abuse, and they work on coordinating resources and response. But they actually just, they run they have a hub on the web of resources and so on that could be, you could download materials. But this year they developed a roadmap, and it's now on their website, which is called A Future Us. And it was created with lots of consultation with other groups, and it's a strategy for the prevention of elder abuse, and it can be implemented and used by different groups. So it was developed for people of all ages and can be used in different parts of society. It's basically principles and steps to combat against elder abuse. That's the website there. You probably can't grab that since we're it's on my slides, but if you Googled Future Us and Canadian Network for the Prevention of Elder Abuse, you'll find it. Another national initiative, the Canadian Centre on Elder Law, probably is the leading organization on legal responses to elder abuse. And laws having to do with elder abuse here in Canada are quite fragmented because criminal code is federal. In the provinces, however, a lot of provinces have laws that provide some sort of response to elder abuse that are in provincial statutes. So, in a couple of provinces, kind of adult protection legislation, but a variety of different things. So the Canadian Centre on Elder Law just created a lovely online website explaining what the laws are across Canada, which I think is terribly, terribly useful. So, and it's a bilingual version, and that's the website there. So just to give some examples of provincial projects that I just wanted to flag. So there are various approaches. As I said, federal government often has funding through a program called the New Horizons for Seniors here, where 70 million a year goes to senior serving organizations with a particular emphasis on raising awareness of elder abuse. As I said, there are a variety of different sources for funding, but there's a wide range of elder abuse response programs, from public education to coordination of, resources and agencies to training frontline workers. So here are just three. So in British Columbia, there's an organization called the BC Community Response Network. And what they do is they develop basically a provincial network in different regions. They have mentors who help train local communities of how to respond to elder abuse. And it's very grassroots, so that every community can stipulate what they need to be effective in responding to elder abuse. The BCCRNs have been around for a while, but they've been undergoing quite a bit of growth recently. So they build capacity in communities. Something that's brand new, however, is this was just announced. The Quebec government has announced that they will invest $50 million in a plan to combat elder abuse. And it has 56 measures to combat elder abuse and raise awareness. And one that I find particularly interesting is they're going to name a prosecutor dedicated to elder abuse, reporting to the province's director of criminal and penal prosecutions. This is useful simply because I think we have a criminal law response that's a bit lacking here in Canada. So this is an important initiative. And lastly, I just wanted to flag Elder Abuse Prevention Ontario. This is just an example of various resources run by various organizations, but I kind of like this one. They developed a video called Future You, which addresses ageism. There was ageism is rife in Canada. There was one study that showed that 63% of adults 66 years of age and older say that they've been treated unfairly or differently because of their age. So this project is very specifically responding to that research. So it's kind of a nifty tool, and you can find that online as well. So conclusion then, I'd just say in a nutshell that recent government studies like the British Columbia study, Hidden and Invisible, confirm that elder abuse is increasing and that much more needs to be done. However, I would say that at the same time, there's increased awareness and some exciting new tools, resources, and projects to help make the response more effective. So that would be what I have to say. So thank you very much for letting me share with you about what's happening here in Canada.
Wonderful, wonderful. Thank you, Joan. Very nice, very interesting. And again, the issue of definitions comes up. And you have provinces and you have federal and then you have WHO.
Yeah.
So that's very, very interesting. And the roadmap, I love that. I did put the link to the roadmap in the chat. So you can click on that and it takes you to a web page. And then if you really want the roadmap itself, you give your email and then you can download it. So that's a very interesting approach to raise awareness and take some action around elder abuse. Wonderful. So next we have my buddy, Jim Peach. I'm going to first introduce him formally. Dr. James Peach is professor and director of the University of Hawaii Elder Law Program at the William S. Richardson School of Law at the University of Hawaii. He's been an advocate for older adults in Hawaii for more than 30 years and has a lot of experience assisting older adults with issues of elder abuse and neglect. So he'll speak on elder abuse and Hawaii. And there are not that many gerontologists on our campus. And so Jim and I are some of the last gerontologists standing. So don't retire, Jim. I would look forward to your talk.
Thank you very much, Catherine. And I might add that we're also some of the first gerontologists on campus. So I think around the world, in those days, there were many people who started out and who are still with it, but we've got to encourage the younger generation to engage. So that's one of the highlights, I think, of this type of an organization. Thank you so very much, all of you, for your attending and also for allowing me to speak today. I'm going to first note that, as in Canada, all states in the US have different laws regarding elder abuse, and some states in Hawaii do not have specific elder abuse laws. So it's very key. So we're sort of small countries in and of ourselves. That's a good way to think about it, with an overall federal assistance and structure and certain laws that I'll get to a few of. But also around the world, as we have heard from Joan, in Canada, that coronavirus was particularly difficult on older adults. And in the United States, there was a massive increase in reports of elder abuse during the pandemic. And they range from financial scams to incidents of family violence. And it was so bad that there were public warnings issued from the Federal Trade Commission, the American Bar Association, and another something to ponder of what was going on during that time. Elder abuse during COVID-19 affected 1 in 10 Americans annually. Prior to COVID-19, 1 in 10 has been assumed that the pandemic has brought with it a surge in elder abuse due to individuals ordered to stay at home, combined with increased interpersonal stressors. Again, while there is no specific Hawaii law that addresses elder abuse, some states do have specific laws, like California, the big state in the United States that has a law that specifically uses age. But in Hawaii, we don't use age. In Hawaii, there is a wide range of laws that can be used to protect abused older adults. And the most comprehensive that I will talk about today is our Vulnerable Adult Protective Services Act. So here's a list of them. I'll go over more closely. The Adult Protective Services Act But as we've seen in several countries, long-term care ombudsman, long-term care is a very big issue. So we have a long-term care ombudsman law in Hawaii. There is what we call a Medicaid fraud control unit, which is in every state. It's federally funded. It's a federal state partnership. And that organization investigates abuse directed against older persons in long-term care facilities that accept Medicaid. So the theory under federal law is, even if it's just not financial fraud against the federal government for, where they're billing improperly, but the theory there is that Medicaid does not pay for a lower level of care, or it does, and certainly does not pay for abuse. So that's how they get into each facility that accepts Medicaid. There is, I said there's no specific law on elder abuse, but legislators like to title things in every country to make it sound grander than it is. So Hawaii does have an Elder Justice Act, but it's very, very limited, and it's just for civil penalties against healthcare facilities, long-term care facilities that have abuse that is detected in those care facilities directed against the residents. Our laws also cover domestic violence laws. Those are used quite usefully in Hawaii in domestic settings where an older person may be living in a home. So it's not just caregivers in an institution, but it can be at home. It can be perpetrated by any individual. And there is, unfortunately, much domestic violence in homes that affect the elderly. Consumer protection laws can be used, including enhanced penalties for fraud directed against older persons. So our statutes in Hawaii provide they will investigate to see if certain vendors or certain businesses are directing fraudulent practices against older persons. One of the examples we have is fraudulent roof repair, where they'll go up and, a senior is not going to go up on the roof and take a look at it, but, they're spraying some paint or something instead of fixing it. So that's a very effective law. Court restraining orders under various provisions of law are very often used where there is abuse directed against an older person. And it doesn't have to be a family member. It can be a neighbor. It can be somebody else. So court restraining orders are used quite effectively. There's a combination in Hawaii, as everywhere in the world, of perpetrators who have mental health issues and also victims who have mental health issues. So there are involuntary civil commitment and treatment laws that can be applied under certain circumstances, either temporarily to address a particular situation or longer term. The penal code, federal and state criminal codes, including enhanced penalties for crimes directed against older persons, is very popular. Joan mentioned that there are criminal penalties for elder abuse. In Hawaii, it's not as widespread for the state law to have provisions for specific laws with respect to older individuals, except for enhanced penalties for laws that apply to everybody. So, for example, if there's an assault on an older person over 60 years of age, then there can be an enhanced penalty if the perpetrator should know that that person was, should reasonably know that the individual was over 60 years of age. So there are numerous laws like that on the books. And then there are civil remedies that private practice attorneys can use. For example, torts, where a person suffers a consequence for somebody's tortious act. And there are civil fraud actions. This will bring up when I get into the Adult Protective Services Act. Civil fraud actions are very valuable, but they're difficult to obtain by most families and most older individuals. I'll give you an example is where I run an elder law program at the university for the past 30 years. We have our 30th anniversary, as a matter of fact. We assist older individuals, and every single week we get calls from either the individual who had a financial exploitation directed against them, or from family members. Either it's a current member who was defrauded by another family member, usually another family member, very often a family member, or it could be a church member. There's a lot of fraud going on in churches. There's a lot of fraud going on in McDonald's, where people meet lonely individuals. But the civil fraud actions, I'll give you an example of a recent one where it was a condominium. And so one nephew had taken over the condominium fraudulently, and the other individual wanted it back. They realized that they had fooled them. They had signed something that was not the paperwork. So there are two ways that you can approach that. It can be considered under some circumstance as a criminal violation, where you're stealing from somebody. So that's one approach, and we have a very effective prosecutor on our island, and other islands do too, with respect to prosecuting individuals and then trying to get back the home. But usually the police and the prosecutor will find that this is a civil fraud action, not a criminal fraud, and then a civil fraud attorney would go after it. I have a colleague who does mainly homes, getting the homes back. But the first question that this individual will ask the victim is, how much is your condo or house worth? Is there at least $200,000 in equity in the home? Because I'll get you back $100,000, but it's going to cost me $100,000 to go through the court process, because it is so expensive, so long drawn out, and that most people can't afford that, or the money's already gone. Somebody has put a reverse mortgage on it, has taken out all the equity, and it's gone, because some of these things happened many years ago. So let's get into very quickly the Adult Protective Services Statute. We originally had, and I believe in Canada, they had some issues that we had before, where an individual, it was in Japan. Forgive me, Professor, about the wonderful presentation you made, where you don't have, there's a question of, is the person a caregiver? Is the person not a caregiver? The prior law in Hawaii was that a victim had to be a dependent adult, dependent upon a caregiver, dependent upon somebody else. So many people slipped through the cracks on that, so that in 2009, the statute was changed to a vulnerable adult. So it's a vulnerable adult who has incurred abuse or is in danger of abuse if immediate action is not taken. And then the Adult Protective Services branch takes steps to prevent further abuse, including legal action, the court, including restraining orders, which has overall jurisdiction over cases of vulnerable adult abuse. And it requires certain persons, and I will get to that momentarily, to promptly report the matter orally to the Adult Protective Services. I should note that in some states, there is no mandatory reporting, but it is voluntary reporting. Hawaii went with mandatory reporting, but not with any age designation. Another interesting concept is that the Department of Health Adult Protective Services may only act with the consent of the vulnerable adult unless he or she is determined by the family court to lack capacity. So what is a vulnerable adult under Hawaii law? It means a person 18 years of age or older who, because of mental, developmental, or physical impairment, is unable to communicate or make responsible decisions to manage the person's own care or resources, carry out or arrange for essential activities of daily living, or protect himself or herself from abuse. It's very limited. I think the state doesn't want to expand to older adults, and I've had discussions with various members of the government about this before, because it's just too expensive. They don't admit that, but in the conversations, they said, we can't possibly do that. And one governor said, look, I'm over 60. I don't want this to apply to me. So, so it's sometimes personal too. Now that I'm well over 60, I'm trying to rethink that too. Maybe I don't want that affecting me. They'll round me up. No, this is not supposed to be directed against older persons. It's supposed to help older persons if it had an age component. And here it's a vulnerable adult. But abuse, as we've seen in different countries, may mean different things, and the World Health Organization. So in Hawaii, it means physical abuse, psychological abuse, sexual abuse, financial exploitation, caregiver neglect, and self-neglect. Self-neglect is an interesting issue, because what about a person's own abilities to make even bad decisions? Two biggest areas are caregiver neglect. One of the areas is caregiver neglect. Caregiver neglect means a failure of a caregiver to exercise that degree of care for a vulnerable adult that a reasonable person with the responsibility of a caregiver would exercise within the scope of the caregiver's assumed legal or contractual duties, including but not limited failure to assist with personal hygiene, protect the vulnerable adult from abandonment, provide necessary food, shelter, clothing, provide healthcare access, including medication, psychological care, physical care, supervision, protect the vulnerable adult from dangerous, harmful, or detrimental drugs, protect the vulnerable adult from health and safety hazards, or protect the vulnerable adult from abuse by third parties. This could be a family member, it could be a hired caregiver, and it certainly can be a long-term care facility. Self-neglect is a little more touchy in Hawaii, but you'll see it's very limited what the Adult Protective Services can investigate. A vulnerable adult's inability or failure due to physical or mental impairment or both to perform tasks of essential to caring for oneself, including but not limited to obtaining essential food, clothing, shelter, and medical care, obtaining goods and services reasonably necessary to maintain minimum standards of physical health, mental health, emotional well-being, and general safety, management of one's financial assets, and here's the big one, the vulnerable adult appears to lack sufficient understanding or capacity to make or communicate responsible decisions and appears to be exposed to a situation or condition that poses an immediate risk of death or serious physical harm. We know many cases of self-neglect do not fit within all those criteria. The reporting, we have mandated reporting, and it does include professionals of the healing arts, such as doctors, nurses, surgeons, chiropractors, etc., as you would want to expect. Employees or officers of any public or private agency or institution providing social, medical, hospital, or mental health services, including financial assistance. Employees of any law enforcement, and also the courts, police departments, correctional institutions, parole and probation officers, employees or officers of any adult residential care home, adult daycare center, or similar institution. And here, here's an interesting one: medical examiners and coroners. This was in the old law, and it was in the version of the old law that was changed at midnight before it went into effect, because the statute now says that you're the only, basically the only role of adult protective services is to stop the abuse, stop from future abuse. Well, what would happen if the medical examiner or coroner reported? APS would say, okay, thank you very much, but the person's dead, so they're not going to be abused. So our statute is mixed with all sorts of strange things that are remnants of old statutes. It should be noted that under Hawaii's Adult Protective Services, they must have the consent of the victim before an investigation or protective action can commence, unless the court finds that there's probable cause to believe that the vulnerable adult lacks the capacity to make decisions concerning the vulnerable adult's person. So I'm going to, and here's the capacity is very important in all of our worlds, means the ability to understand and appreciate the nature and consequences of making decisions concerning one's person, or to communicate such decisions. And an individual is presumed capable of making his or her own decisions if it is determined that an individual lacks capacity under this part of the law. It does not mean that he or she lacks capacity for any other purpose. I'm going to leave it there because we are running quickly out of time, and I'm very much interested to hear about elder abuse in Australia.
Jim, thank you very much. Yes, I can't believe how quickly the time has gone. Fortunately, our speaker, Aloma, is okay to present. She doesn't have to run off to another meeting. Thank you very much. So, Jim, as always, thank you for pointing out all the complexities and catch-22s in Hawaii law, and thank you for all your work in Hawaii to try to prevent and control elder abuse and neglect.
I'm going to stop
our
share.
last
Okay, there we
speaker
go.
is Aloma Fennell. She is the founder and executive director of the Senior Agenda in Australia. She also is the Australian representative to INPEA, and she's a steering group member of the Global Alliance for the Rights of Older People and a steering group member of Equity Rights Alliance. And she will present on elder abuse in Australia. And after that, we will open for questions and answers.
Thank you, Catherine. Can you hear me okay?
Yes, we can hear you.
Yeah, good. Okay, good. I'll begin with a couple of quotes. The world is a dangerous place, not because of those who do evil, but because of those who look on and do nothing. End quote, Albert Einstein. You know the heart of a society by how it treats its most vulnerable. And while it may take a village to raise a child, it also takes a village to respect its elders. It's important to recognize that approaching the issue of elder abuse from a single perspective is not appropriate. Why? Because there are a number of forms of abuse of older persons. The most commonly recognized: emotional, neglect, physical, sexual, and financial, among other. The definition that has been adopted by WHO, the World Health Organization, elder abuse is a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust, which causes harm or distress to an older person. Worldwide, around 1 in 6 people 60 years and older have experienced some form of abuse in community settings during the past year. This is appalling. The World Health Organization believes that most developed world countries characterize old age starting at 60 or above. However, this definition is not applicable to a place like Africa, where more traditional definition of elder or elderly person starts from 50 years of age. So rates of elder abuse are high in institutions, in nursing homes and long-term facilities, and they have increased during COVID-19. Elder abuse can lead to serious physical injuries and long-term psychological consequences. Worldwide, women exiting a violent relationship face significant barriers to finding suitable accommodation, particularly around stability, privacy, and security, which also limits what is available to them in terms of security. The past decade in Australia has seen renewed policy interest in access to justice for women. And in turn, this has highlighted the need for evidence-based research on the legal needs of socially and economically disadvantaged groups. I'm sure this applies to groups around the world, really. Older persons or people over the age of 65 have been recognised as a distinctly burdened group. Those who are vulnerable to substantial legal problems with adverse impacts on their life circumstances. Yet the legal needs of this group remains largely unmet, hidden from the legal service providers and complaint handling bodies. While not currently proven in terms of prevalence or incidence of legal problems, the evidence does show that older people face particularly strong barriers to gaining legal assistance and achieving satisfactory resolutions. With almost 15% of elders or elder Australians experiencing some form of elder abuse, the legislation should provide an important safeguard to prevent any further abuse that leads to harm or financial disadvantage. Anyone found guilty of committing financial elder abuse in the Australian Capital Territory, here in Australia, for example, could now face up to 3 years behind bars under a new suite of laws that has been drafted to protect older Australians from neglect, harm and abuse. This is wonderful. Maurice Blackburn, who is a principal lawyer, said at the Australian Capital Territory's initiative in introducing a specific crime for elder abuse will bring victims and anyone concerned about possible abuse, quote, the confidence to report it to police for investigation, end quote. This is very important. So just some key facts here, and I'll close on this. Around 1 in 6 people here in Australia, 60 years and older, experience some form of abuse in community settings during the past year. Globally, rates of elder abuse are high in institutions such as nursing homes and long-term care facilities. Rates of elder abuse have increased during COVID-19 pandemic. Elder abuse can lead to serious physical injuries and long-term psychological consequences. Elder abuse is predicted to increase as many countries are experiencing rapidly aging populations. I might leave it there, Catherine, and thank you for the opportunity to be able to speak on this topic. Thank you.
Thank you very much. That's very, very incredible. 1 in 6 is a very high. I'm just flabbergasted by the statistics, and all of you mentioned that it will increase, elder abuse will increase with our population increasingly getting older, and also COVID was not helpful in this situation.
Yeah. I think, Catherine, just to interrupt you, my apologies for doing that. What I didn't say was, and what surprises most people who call Australia the lucky country, we have no Bill of Rights here in Australia, none whatsoever. I'll leave that there.
Oh my goodness.
Mm-hmm.
So that it makes it difficult to prosecute and move forward with rights. That's why you're on all of those rights groups.
Mm-hmm. Indeed.
Okay, well, thanks. We have run over time, but let's spend at least about 9 minutes, if I can indulge you in questions and answers. And there was several for Dr. Wada about examples of self-neglect in Japan, and how many cases in facilities versus home settings.
Thank you for your questions. I already asked questions about self-neglect, and next I would like to talk about a question about Miss Abe Tomoko. Thank you for your question. To tell the truth precisely, there is no statistic about incidence of abuse in domestic settings and institutional setting in Japan. We only have statistics of reported cases. In 2020, reported suspected institutional abuse cases, 2,097 cases, and confirmed 595 cases confirmed in Japan. And reported suspected domestic abuse cases, 33,774, and confirmed cases, 17,281 in Japan. And also, we don't have data in medical care settings because central government is not correcting the data.
Oh, that's too bad. Yes. Okay, thank you very much. And were there other questions? Other questions from our audience? Someone had their hand up, but I cannot see it right now. Okay, I'm not seeing any other questions. Well, this was a very sobering presentation today. And I do know that many of you are interested in hearing more and learning more. So please look on the chat and you will be able to get the links to Mala's books and also the roadmap. And also, if I'm going to ask the presenters if they would mind, if we could share their PowerPoints, if sometimes we get asked to share PowerPoints, is that okay with our presenters that have PowerPoints? Jim, yes? Be able to share your PowerPoint? Dr. Wada?
Yes,
Yeah.
of course.
Okay, Joe.
Sorry. Can I answer some question from Dr. James Peach of Hawaii? I think he asked the question concerning abuse on dependent adults, and I would like to answer. We can see dependent adults sometimes get abuse from non-caregivers. For example, grandchildren who are not engaged in care, we think especially financial abuse is very common. And also, I think abuse on independent adult is not excluded in definition of both in Japan and of WHO definition. So we sometimes encounter elder abuse on independent adults, and they are sometimes continuation of DV. It's okay? Makes sense?
Yeah, and that makes sense. Yeah, you're absolutely right. We used to have dependent adults, but there no longer is the requirement. But we still have the requirement here that the person has to be a vulnerable adult, and not just any older individual who has abuse. And that's a real problem, because if we could just give the older person, let's say a 95-year-old person, the benefit of the doubt and to provide a little more resources to them, because it's a really difficult challenge, And as in Australia, as we heard, it's very, very hard in the US to get legal representation to combat elder abuse, to get it back. So we have legal aid services, but it's still very difficult. So I think we all share as a world limitations, and it's very hard to go in front of our legislatures and ask for funding for these programs when they say, well, we have cities to build and trains to run and all those things. So I think and the last time I ventured to the legislature, I haven't done that in a while because they told me, just don't, we know what you're going to say. But they did tell me that find yourself some young people who will come and testify, because it's always the same people testifying the same thing. So get the younger people involved. And if they are concerned, they're going to be the voters that we worry about. So get them to come in and engage. So it's like at the university I mentioned with my chat with Catherine, is that we need to engage the younger generation in this quest.
Okay, we do have a question from Pratibha Mishra, and I'm not quite sure how to unmute you. I've clicked all the buttons I can. So if you can unmute yourself, or if not, if you can put your question in the chat. I also see Vinod, you have your hand up, but I can't, oh, there you were able to unmute yourself. So.
Yes. Well, thank you, Catherine. I think impressive statistics have come out from different countries in a very informative webinar. And there are also ways described how to combat abuse. They are mainly the legal ways that we have heard from time to time. I was wondering if a message goes down to the population at large, that protection and maintenance of health and activity during the entire life course through self-care practices is practiced, then it ensures to some extent activity, independence, and good health in old age. And we are sure that people who are physically and mentally capable, remain capable in old age, they are less liable to have neglect and abuse. So I would go in for vouching such messages to go down to the population, that we should maintain our health and activity for as long as possible. And in that case, people even up to the age of 80 or 85 who are financially capable, physically and mentally capable, they are going to face lesser and lesser abuse. That is just my comment. If anybody would like to respond to this, it would be welcome. Thank you.
Okay, any response? Okay. Oh, thumbs up from Jim. Okay. Pratibha, here's a question to Dr. Mala. Elder abuse, more in educated people, but not reported. How to stop it? Mala, are you still here? There you are.
Hello, can you hear me?
Yes.
Okay. Actually, it's very difficult to say that among which section of the population or segment elder abuse prevalence is more, because we still don't have enough research. Few national surveys have been conducted, but we are still trying to identify who are the most vulnerable sections. What my research has found out, yes, educated people may be less abused in terms of support from or care from their family members or community members. But they are getting, in spite of their literacy levels be high, they are getting vulnerable to financial abuse and to institutional abuse, as I pointed out in my presentation. Because the thing is, at a certain age, their emotional security breaks down. They might be very much aware of how to take care of themselves, but due to health vulnerabilities, the emotional security breaks down and they become dependent on institutions or on people who are guiding them. And then the element of exploitation and mistreatment rises. And then vulnerability to abuse becomes quite common. We find that in some of the developed countries where literacy is high among older people, abuse is still taking place because there are various factors which lead to abuse. And we still do not have research for us to identify what is the factor which can be controlled. Yes, economic independence helps, physical independence helps, uh, literacy in terms of responding to their own rights, taking care of themselves helps. But still, the vulnerabilities which emerge from various quarters requires much more research. Thank you. I hope many of my other co-panelists would agree with me that this field requires much more in terms of understanding what is abuse, how do we identify it, how do we detect it, how do we manage it, how do we respond to it.
Mala, may I speak?
Oh, we finally got you.
Catherine?
Yes,
May-
go ahead.
Mala, can I speak? For a
Yes.
minute?
Yes, please, go ahead.
Yes, but please keep it brief.
Yeah. No, very well, prevention is better than cure. Yeah, suppose in case these affected people are there in a house and nobody is there to complain about them, is there any way of government officials or, social service activities who could visit home and find out who the affected people are? Is it possible?
You see, this is what we are doing. I'm involved in some training programs for people in institutions and all. How do we detect abuse? And then once it's detected, how do we respond to it? Many doctors are being trained because they are the ones whom many older people visit at the primary healthcare center, in hospitals. And also we are trying to get in touch with administrators of old age homes, long-term care facilities, how do they identify signs of abuse? And once those things are able to detect that abuse is taking place, then how do we prepare ourselves and prepare the older person to move away from that abusive environment? And what kind of changes we bring in the environment so that it becomes more amicable for their living. Like I said, that there is lots more work to be done. We have taken few steps in India and in few other countries also, with the Ministry of Health and with WHO guidelines. We are in the process of training medical professionals at different levels, nurses, general practitioners, specialists who are into geriatric practice, that once they come in contact with older person, no matter on what regard the older person is approaching them, they must become more aware of identifying, detecting abuse. And we are also working with the legislative enforcement agencies, doing some training programs with the police, where we need to look at it in terms of that if an older person approaches them, or they are, many police in India especially, constables, people from the police station are visiting older people in their homes, keeping a track on them. We are encouraging senior citizens to register with the police so that there is more communication, there is more dialogue, there is more sharing, and therefore identification of abuse can become more visible and something can be done. Like everybody has been saying, most cases are going unreported. Most cases are, even if some signs are there, people don't know how to address them. So it's a field where the governments, the civil society members, the experts, the senior citizens themselves, older people, we all have to come together. And yes, there is an importance of educating the young. And we are doing programs with schools, we are doing programs with colleges, we have also started doing programs at workplace to raise awareness on these issues. So I think we have another decade or so for a very concrete action plan. And maybe in 10 years' time, we see some visible result in addressing and combating elder abuse. Thank you.
Oh my gosh, what a wonderful webinar this has been. So we are really over time, and I do see that people are leaving. So I would like to officially close the webinar. There is another question that has come up in the chat. So those of you who need to leave, thank you very much. Please thank you for joining us. And Dukli, if you'd like to stay and ask your question, I'm sure some of the speakers will stay and try to address that for you. But this has been great. I do thank our speakers. It's been a very important topic, and do invite you to continue to participate in our webinars with ACAP. So thank you very much. Officially close the meeting and stop the recording. Thank you. Yay.